Did you know that it is entirely possible to lose as much as 90% of your kidney function before you even realize something is truly wrong? It is a terrifying thought, but your kidneys are often referred to as the silent sufferers of the human body because they are remarkably resilient and rarely complain until the damage is already severe. These two bean-shaped organs work tirelessly around the clock to filter waste, balance fluids, and regulate critical hormones, yet we often take them for granted until a crisis emerges. If you have been feeling off lately or just want to stay ahead of your health, you need to know what to look for. Welcome back to the channel, where we focus on body wellness and evidence-based nutrition to help you live your healthiest life. Today, we are exploring the body's filtration system. We are going to break down the 7 major signs that your kidneys might be crying for help. These are symptoms that are frequently overlooked or attributed to other minor ailments, but recognizing them early could be the key to preventing chronic kidney disease. Please remember that while we base this content on scientific research and physiological mechanisms, this video is for educational purposes only. If you experience these symptoms, please prioritize seeing a healthcare professional for a proper diagnosis. The first and most immediate sign that something might be wrong with your renal health involves changes in urination function. Since the primary job of the kidneys is to filter waste from the blood and produce urine, it makes sense that the first warning signs would appear here. You need to pay close attention to frequency, color, and consistency. One of the most common red flags is the need to urinate more often, especially at night, a condition known as nocturia. This happens because the kidney's ability to concentrate urine decreases, leading to an increased volume of urine that wakes you up from sleep. However, it can also go the other way. You might notice a significant decrease in urine output despite drinking normal amounts of fluid, which suggests a blockage or failure in filtration. Beyond frequency, the consistency of your urine tells a deeper story. If you notice persistent foam in the toilet bowl that requires you to flush several times to clear, this is not normal. This foam indicates the presence of protein in the urine, specifically albumin. Under normal circumstances, your kidneys act like a fine sieve, keeping essential proteins inside the body while letting waste pass through. When the kidneys are damaged, those filters become leaky, allowing protein to escape into the urine. This is chemically similar to the foam created when you beat egg whites, as albumin is the same protein found in eggs. If you see this sign, your kidneys are signaling that their structural integrity is compromised. The second sign your kidneys are struggling is unexplained swelling, medically known as edema. This usually occurs in the legs.
Your kidneys are responsible for regulating the balance of sodium and water in your body. When they function correctly, they excrete excess sodium.
However, when kidney function declines, sodium retention occurs. This excess sodium holds onto water, leading to swelling. You might notice that your shoes feel tighter in the evening than they did in the morning, or that when you press your finger into your ankle, the indentation stays there for a few seconds, which is known as pitting edema. Swelling around the eyes, often referred to as periorbital edema, is particularly specific to kidney issues. This puffiness is often a direct result of the protein leakage we discussed earlier. When you lose a significant amount of protein through your urine, the oncotic pressure in your blood decreases. This pressure acts like a magnet to keep fluid inside your blood vessels. When protein drops, fluid leaks out into the surrounding tissues, and the loose tissue around the eyes is one of the first places this fluid accumulates, making you look tired or puffy even after a good night's sleep. This brings us to the third sign, which is a profound sense of fatigue, weakness, or trouble concentrating. We all get tired, but kidney-related fatigue is different. It is persistent and debilitating. This happens due to a combination of toxin buildup and anemia. When kidneys fail, waste products like urea and creatinine build up in the blood instead of being filtered out. This condition, called uremia, can make you feel sluggish, weak, and mentally foggy. It is as if your body is slowly being poisoned from the inside because the trash is not being taken out. However, the more specific biological mechanism here relates to hormones. Healthy kidneys produce a vital hormone called erythropoietin. This hormone signals your bone marrow to make red blood cells, which carry oxygen to all your muscles and your brain. When kidneys are damaged, they produce less EPO. This leads to a drop in red blood cells, resulting in anemia. Without enough oxygen, your muscles tire easily and your brain struggles to focus. If you find yourself needing to rest after simple activities that used to be easy, or if you feel constantly lightheaded, your kidneys might be failing to support your blood supply. The fourth sign is one that many people rush to the dermatologist for, not realizing the root cause is internal: dry and incredibly itchy skin. This is not just the standard dry skin you get in the winter. This is a bone-deep, persistent itch that does not go away with regular moisturizers. This symptom is often a manifestation of mineral and bone disease, which frequently accompanies advanced kidney disease. Your kidneys play a crucial role in maintaining the right balance of minerals and nutrients in your blood, specifically calcium and phosphorus. When the kidneys can no longer maintain this balance, phosphorus levels can rise to dangerous levels in the blood. This accumulation pulls calcium from your bones, making them weak, and deposits these minerals in the skin, causing severe itching. It is a sign that the chemical balance of your blood is fundamentally disrupted. If you have itchy skin paired with any of the other symptoms we are discussing, it is a strong indicator that your kidneys are struggling to regulate mineral levels. Moving on to the fifth sign, we have a metallic taste in the mouth or ammonia breath. Patients often describe this as having the taste of iron or pennies in their mouth, or finding that food simply does not taste the same anymore. Specifically, many people report a sudden aversion to meat. This, again, is due to the buildup of toxins in the blood, specifically urea. When urea accumulates because the kidneys are not filtering it out, it breaks down into ammonia in the saliva. This causes uremic fetor, which is a fancy medical term for urine-like bad breath. This can lead to a loss of appetite and unintended weight loss, which creates a vicious cycle where your body becomes malnourished, further stressing your organs. If your partner or friends mention that your breath smells distinctively bad or like ammonia, despite good. Oral hygiene. Do not ignore it. It is a classic sign of uremia. The sixth sign is pain, but not just any pain. We are talking about specific kidney pain, which is often misunderstood. The kidneys are located toward the back, just under the rib cage, on either side of the spine. Pain from the kidneys is usually felt in the flank area, your sides, or mid to upper back, rather than the lower back where muscular strain usually occurs. Kidney pain can be dull and aching or sharp and severe. A dull ache might indicate an infection or swelling, while sharp waves of pain are classic signs of kidney stones moving through the urinary tract. Another potential cause is polycystic kidney disease, a genetic disorder where fluid-filled cysts grow on the kidneys, causing them to enlarge and press against sensitive tissues. Unlike back muscle pain, which often changes when you move or stretch, kidney pain is usually deeper and does not get better with a shift in position. If pain wraps around to your abdomen, your kidneys are likely the source. The seventh and perhaps most dangerous sign is high blood pressure, or hypertension. This is unique because it is both a cause and a symptom of kidney disease. Your kidneys and your circulatory system depend on each other. The kidneys use nephrons to filter waste from the blood. If the blood vessels are damaged by high blood pressure, the nephrons that filter your blood do not receive enough oxygen and nutrients. Conversely, healthy kidneys produce a hormone called renin to help regulate blood pressure. When kidneys are damaged, they may release too much renin. This creates a destructive feedback loop. Damaged kidneys raise blood pressure, and high blood pressure causes further kidney damage. If you are diagnosed with high blood pressure, especially at a young age, or without a family history, it is imperative to check your kidney function. It might be the distress signal that saves your life. Now that we have covered the 7 signs, it is crucial to understand what you can actually do to support these vital organs. While you cannot always reverse damage, you can certainly slow the progression and protect the function you have left. The first step involves hydration, but with nuance. While drinking water helps flush out toxins, overhydrating can actually burden damaged kidneys. The goal is to keep your urine a light straw color. More importantly, you must look at your diet. The Two biggest enemies of the kidney are sodium and processed sugar. High sodium intake forces the kidneys to work overtime
to excrete the excess, raising blood pressure in the process. Reducing salt intake is the single most effective dietary change you can make.
Furthermore, keeping your blood sugar stable is vital because high glucose levels act like shards of glass in the delicate blood vessels of the kidneys, causing diabetic nephropathy. Even modest reductions in processed foods can have a massive protective effect. Finally, be cautious with over-the-counter medications. Non-steroidal anti-inflammatory drugs, or NSAIDs, like ibuprofen and naproxen, can reduce blood flow to the kidneys. Taking them regularly for chronic pain can lead to analgesic nephropathy,
a form of kidney damage caused by drugs. If you have any risk factors for kidney disease, ask your doctor for safer alternatives.
For pain management. To summarize the key takeaways from our deep dive today. First, pay close attention to your bathroom habits, looking out for foamy urine or changes in frequency. Second, watch for physical changes like swelling in the ankles or eyes and persistent deep itching of the skin. And third, monitor your systemic health, specifically your energy levels and blood pressure, as these are often the silent indicators. Your kidneys are resilient, but they are not invincible. Listening to these subtle cries for help can be the difference between early intervention and chronic disease. If you found this information helpful, please consider sharing this video with a loved one. It might just be the prompt they need to get a checkup. We are committed to helping you understand your body better. So if you want to stay informed about your health, hit that like button and subscribe for more deep dives into human physiology and nutrition. Take care of your body, stay hydrated, and we will see you in the next video.